Hi everyone. I wanted to give you guys an update on how I'm feeling. As you can see, I'm shiny. I'm going through a sweating stage now. I have the sweats and then the chills. This is what happens after chemo for me, because I get feeling like very viral after I have chemo, but this is not as bad as it was last time at all. So that's good. I am definitely not doing as poorly as last time. I am having to stay in bed and not do a lot of other stuff like out of bed. If I get out of bed, the cold sweats will get worse. The burning in my body will get a little bit worse. I have had some burning going around like this and then up the back of my head. And then yesterday when I was feeling the back of my head because it was really like itchy, I found a few bumps. So it does look like I'm having a little bit of a breakout, maybe like a little herpes breakout on the back of my head. So that's one of the things that gets me nervous is that virus, and I don't like having it so close to my brain. Um, so that's something that I'm dealing with right now. That's something that I dealt with a lot in the past. In 2020, when I was very sick, it was much worse than this. Like I just have like little minor bumps that are like, burny and itchy. When it was back in 2020, I mean, my whole neck was red. I was having like all kinds of much worse than this. I couldn't even get out of bed without, I would need my husband's help to go to the bathroom. Now I can get up and go to the bathroom and stuff like that. And I can go downstairs and get myself something to eat. I just might have a cold sweat out or something like that, or just not feel that well. Um, so I just want to convey to you guys that I am doing pretty darn well for how I do with these treatments. My body does not like this drug at all. It seems like whenever I get this daratumumab, it really increases my likelihood to get the shingles, and that's what happened the last time. Basically, is I kept getting dosed with it, and I got them so bad I couldn't get rid of them for a long time. So we're just going to keep monitoring this. I have 6 weeks to go until my next appointment. So that's the good news, is that I don't have to worry about, I mean, I have a lot of good news. One of the good news is though, I don't have to worry now about my cancer getting worse if I wait 6 weeks for another treatment, because now I know that's not an issue. My cancer did not get worse when I waited 6 weeks for a treatment. So I know that that spacing is good. I also know I'm going to get an IVIG treatment, which is an immune infusion on Tuesday. And hopefully some of the people that make up that immune infusion have had like shingles or herpes. And if they have, then those will go into my system and that will help me fight this. And I get that on tomorrow, Tuesday. I get that tomorrow. So I'm really thinking that, this is going to be okay. All is going to calm down, because I have really felt a lot worse than this. I just, I think some of it is medical trauma from the past, and, where I got really, really bad, and, and without like, notice, like I've gotten really sick and had these attacks like with not a lot of notice. And so some of that, when you get that feeling like you don't know what your body's going to do 1 minute to the next, it can cause some anxiety. And then when you go in and get these kind of treatments where you've had reactions in the past, it's just, I think, I think that's a lot of what I'm dealing with is that, um, because the physical symptoms are, I'm staying in bed and I'm doing some painting and stuff like that. So I can certainly manage the physical symptoms, and hopefully tomorrow's IVIG treatment will give me the immune boost I need to get out there and do the other stuff I want to do, like repot my plants and finish building the greenhouse. Um, but I wanted to talk to you guys about something that happened on Friday when I was at the hospital. And I want to talk to you now while it's still fresh in my mind, but it was too fresh on Friday and I think I talked to you guys on Saturday too. And so I needed a little time to process it, and I'm still not done processing it, but I've processed it enough that I'm able to talk about it. So when I was in the waiting room was about half full when we got there. So there was able to be spaces between patients. And I sat across from a lady who had obviously had her transplant like just about 60 days ago, because she was completely bald still and was wearing like the head wrap and still looked pretty frail. So she was definitely within like 45 to 60 days after transplant. She was out of the hospital and coming back in. So she could have even been sooner, maybe even 30 days post-transplant. So she was sitting across from me and she was looking frail, and her husband was with her. So I was grateful for that. And I saw the room was filling in. And it got to the point where almost every seat was taken, and some of the newer people that came in were not wearing masks. And so I had an extra N95 that was still wrapped and sealed. And so I got her attention and offered her that mask. She was wearing a standard mask. And I said, I don't know, if you want this or not, but I just thought I'd offer it. And she said, no, she was okay. She's obviously felt nervous, but I think she just didn't want to put me out. That's what it seemed like. She was very, very, like, very into herself. Like, she seemed like she was nervous, anxious about things going on, and possibly not feeling well. And she just, probably didn't want to put me out. Maybe she didn't want to take off one and put another one on. I'm not sure. But we talked a little bit after that, and I showed her how my hair had come in all curly, and how it was straight before, and how she could look forward to wondering what her hair would show up like. And so it was a nice conversation we had. And as it turns out, we were both sent back to triage at the same time. So before you go get your treatment, you go to triage, where they take your blood and they test it to make sure that you're healthy enough to get your chemo treatment. So we both go to triage, and there are basically two areas. There's the area where they go and they take your vital signs, and they'll also take your blood for the test. But if you need an IV put in, you go to the other side, and then a nurse will put the IV in. So all the times in the past when I've gone to get my treatments, except for the last time and this time, I've had to go get the IV put in. So I usually go and I sit on the triage side, get my vitals taken, and then I get moved over to the nurse and they put the IV in. And I've had some interactions with the nurses that haven't been the most pleasant at times. For example, I've done things like said, hey, this is where, is an easy stick. And they've been like, I'll tell you where the easy stick is and all that. Which is, I'm like, okay, it's been interesting at times. How some of the nurses interact with the patients, and some are very, very good. But anyway, I had difficult interactions, and I'm a hard stick. And so, you know, that makes it like they're less likely to want to take me as a patient too. Well, luckily for this new treatment that I'm having, I don't need to get an IV. They draw my blood, and then the infusion is an injection that they basically inject over about 5 to 6 minutes. She just sits there and over a timer puts it in with this big syringe, right? So that's all. I don't need an IV. So the last time and this time, I've been able to just get my blood drawn by the nurse's aide. And when I show her, I'm like, oh, here's my spot. She's like, great. And she just goes in and gets it. And she's been really nice and friendly. And and she's been the same nurse's aide that's been taking my weight this whole time and everything. There's been a few different ones, but there's never been any issues with them. It was when I went to get the IV. Well, I went back with this other lady, like I said, who had just gone through her transplant. And evidently, the treatment that she was having to get that day required her to get an IV. So I was sitting and I was getting my blood drawn, and she went to the other side behind, it's just behind a curtain, and she was getting the IV. And I heard the nurse yelling at her. And I started to just get so upset. I heard her little voice. No, no, I didn't mean anything by it, like that. This woman is, my age or older. I would say she's my age or up to 10 years older, maybe up to 65. It's hard to tell when someone doesn't have hair and they're wearing the scarf and stuff. So anywhere between, I forget how old I am, 55 or 56. I'm 56. So anywhere between like maybe 56 and 65 she was. And she's like, well, you're giving me attitude. Why are you giving me attitude? And that's what the nurse said. And I didn't hear anything coming from this woman, but no, I didn't. What I was thinking is probably because the nurse was not wearing a mask, and this woman just came through a transplant, and she just has on her standard mask, not an N95. And I bet that nurse was right up in her face when she's going, because that's what they have to get real close. They're looking at your arm. And I bet the woman got nervous and got up and had maybe a nervous, I don't know how she could see it because she was wearing a mask, but maybe her eyes looked nervous, or maybe she was like freezing up or something. But whatever she was doing, it was not like she was vocalizing, because I could hear, I started listening very closely to hear if that woman was like complaining or what was going on. And all I heard coming from her was, no, 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 please, just please go ahead. I didn't mean anything. And the nurse saying, if you're going to be trouble and stuff like that. And I was like, part of this, I really had a hard time with. I didn't know what to do. You want to say something, but I felt like if I stood up and said something, it just would have made it worse. I thought if she denies her care or brings anybody else in, I'm going to stand up and say that woman did nothing wrong. But I thought at this time, it's better for me to hopefully this will blow over. She'll get the line in and things will be okay. And I looked at the lady who was doing my blood, and I had a feeling that she was going to look out and make sure things were okay too. We just sort of looked at each other. I don't know if you ever have had that experience where you just sort of look at each other and you feel like, okay, like she was just letting me know it'll be okay with that other lady. But yeah, it really, really got to me. And I don't know what ended up happening, because I ended up being done, and they were still they were still back behind the curtain. And my nice nurse's aide took me and my husband back to our room. And I don't know if hopefully it sounded like the nurse was calming down when I left. But I just hope that everything went okay. I have like nausea now thinking about it. I just know how difficult and I've said, the nurses have very difficult jobs, and I really feel for them, and I know what they're going through. But the thing is that these patients are going through something even more difficult. And on my videos, I've said a lot and made a lot of allowances for how I've been treated, um, and dismissed. I basically reached out for weeks trying to, get clarification on my treatment plan, and basically got all the information yesterday, which basically they told me that I will be on this drug until it stops working. That there is no stopping this drug. Basically, when they say you'll be on Dara for 2 years, that's because on average it stops working to treat the cancer after 2 years. So I just really didn't understand that. I thought this was like a 2 to 3 treatment kind of thing. Like I thought it was like, and at first he said like every 8 weeks and I thought like, oh, every 8 weeks and maybe for like 3 times or something. So, I really am, disappointed in the quality of the communication, that I had with my doctor. And then I'm also disappointed that when, we didn't understand, I got basically yelled at, for not, understanding what was going on. I don't know what's going on at that facility. Maybe they are experiencing high stress levels or something that is making them snap and abuse their patients. But what I heard happened to that, I would never say anything that happened to me was abusive, just because I have such a I've taken so much shit in my life and dealt with like really horrible abuse that like, maybe I should have, considered more things abusive. But what when I saw it happen to another person, that's when I was like, this is fucking abusive. I mean, that woman's meeker than me, and I don't know. Anyway, I don't know what I'm trying to say here, but I'm definitely not going to be silent on this. I've decided that I need to talk to someone about it, and I haven't decided who yet. If you guys have ideas, I was thinking I could talk to the social workers about it and say that I'm noticing this issue. I don't know. They could refuse to have me as a patient, if I cause trouble. I've, basically been told that. Um, it's really a hard situation to be in. They have, I guess, too many patients, too many multiple myeloma patients sick with cancer. And, yeah, too little time to take care of them. And unfortunately, people who are fighting for their lives are suffering, and they're being mistreated by some of the staff, in my humble opinion. So that's what I wanted to talk about, and that's what I wanted to say, and it's a lot, and I hope it doesn't get me into too much trouble. It might, and I hope it doesn't jeopardize my care. But this needs to stop. It's not okay to happen to other people. Anyway, I'm going to stop thinking about that, and I'm going to think about how much I love you guys. I love you guys so much. You guys are such a kind and generous and loving community. I hear from some of you sometimes, some of you other times. You know, all of you are so busy. This is going to be a long video. Um, and so I know that you all can't keep up with everything, and I don't expect you to. I just appreciate you guys checking in every once in a while on me and sending me your prayers. I love you all so much.